Come in.
Hi, I'm Nurse Kathleen.
Hi.
How are you?
I'm good.
What's your name?
I'm Cassandra.
Hi, Cassandra. So, what brings you in here today?
Well, lately I keep having this weird rash that I get on my face every once in a while, and it's really strange.
Like, what brings this on?
It's mostly, actually it's only when I've been drinking.
Drinking juice, water, alcoholic beverages?
Alcoholic beverages.
Okay, so the thing that provokes this is the alcohol. So when you get the rash when you drink alcohol.
Mm-hmm.
Okay, what does the rash look like?
It's like dark reddish, almost purpley kind of, and it's like blotchy, and it's not like hives where it's like itchy or something.
So it's just kind of there.
Yeah.
Okay, and is this a constant thing when you drink, or does it happen only sometimes, or is it all the time?
Only sometimes.
Only sometimes. So when you say sometimes, like, how often would you say? Like, every 2 times you drink, or?
Well, it just started recently. I mean, I'm in college, so, I drink kind of frequently.
Mm-hmm.
And, it never was a problem before, and it was just this past week it happened like 50% of the time, maybe.
Okay, and would you say that when this rash started to come about, you were, had already had a lot of alcohol in your system, or was it just, just a little bit?
It was different times. The first few times I didn't have that much in my system, and the last time it happened, I already had been drinking for a while.
Okay. Now, the region of this rash, is it just on your face, or does it radiate into other parts of your body?
Most of the time it's only been on my face, but one time it did spread to like my neck and onto my chest and my back and my shoulders.
Okay, so when it spread to your chest, back, shoulders, and neck, and at any times did it itch?
Nope.
No, it wasn't itchy. Were you hot at all?
I was hot. Yeah.
So was it heat only on the rash, or was there heat on all parts of your body?
I was just like feeling kind of hot, but it was like heat radiating from where the rash was.
Okay, now were there any other symptoms that you had? Like was your heart racing? Were you tired, or?
The one time when it did radiate to my chest, my heart was racing a lot.
Okay. Now, on a scale of 1 to 10, 1 being no pain at all, 10 being the worst pain you've ever felt in your life, close to death type of pain, what would you say your pain was?
It was 6-0.
Okay, so you didn't feel any pain at all. So it really wasn't affecting you so much. It was just kind of like it's a concern, a big concern to you. Okay, now, when did this happen? When did this start?
It was just last week.
Just last week. So it's only been a week since this is happening. It's happened to you. How many times has this happened?
3.
Like 3 times? Okay. So is there anything that you think that you might be able to guess what this is, or do you think you have an idea what it could be?
Well, at first I thought it was an allergy to something, and my roommates and I tried to figure it out. We're ruling things out, but I mean, it seems like it was too out of nowhere to be an allergy, because, when people say that you develop an allergy, they say it's like, slow developing, so.
Right.
I don't really know. And the weird thing was that it went away really quickly, the rash.
Okay.
After I got it would take like 5-10 minutes tops for it to go away.
Okay, great. Okay, so now we're going to continue on the physical assessment of your vital signs, and then the doctor will be in shortly.
Okay.
Okay? So, at this point, this is when I would go to wash my hands. And when washing your hands, I would sing 2 happy birthdays to myself to show, and scrub my hands really hard, and make sure soap gets in all the crevices of my hands, and rinse with hot water, and dry them nicely. Okay. Also, I would be taking her height, weight, and temperature. Her temperature, the temperature range is 96 to 99. And if she's within that range, That's good. And if she's not, then that means she has a fever. Okay, so now I'm going to take your pulse. I'm going to take this on the radial side of your forearm. I'm going to use 2 fingers and go from her thumb down and push right there. I'm going to take the pulse for 30 seconds, okay? And the normal pulse is 60 to 100 beats per minute. Okay, ready? Here we go. Okay. Now, her pulse rate was 72 beats per minute. If it was less than 60 beats per minute, that would mean she would have a slow pulse, and it would be bradycardia. And if it was greater than 100, it would be tachycardia. The rhythm was steady, even tempo, and the force, it was elastic, and it was a 2+ on the scale rating, and her elasticity was soft. There was no springy. It was springy, and there was no stiffness. Now, as I was taking her pulse, I also took her respirations. Taking the respirations, you want to be secretive about it, meaning you don't want to tell the patient that you're taking their respirations, because that's when they'll get nervous and their breathing pattern will change. The normal range for respirations is 10 to 20 in an adult. In this patient, it was 16 respirations per minute. I took these right after the pulse. After I took the pulse for 30 seconds, you can see my head shifted from looking at her wrist to looking at her chest. When looking at her chest, I looked at the symmetric expansion. The symmetric expansion is her chest moving in and out as she breathes. It moved at the same level as she was breathing. The patient position. The patient was sitting upright and straight with her feet on the ground. She wasn't hunched over, meaning she was able to breathe perfectly fine. She wasn't having troubles breathing, and she wasn't wheezing or anything like that. So now I'm going to take her blood pressure. The cuff size should be 40% from her elbow to her shoulder, and it should be 80% around. So for the circumference of her arm, it should be 80%. Okay, I'm going to ask the patient to lie her arm with your hand straight out. Thank you very much. Would you mind sitting straight up with your feet flat on the ground? Thank you very much. Okay. The arm, notice, is above the heart, which is what it needs to be. The palm is up. The feet are flat. The legs are not crossed. Okay. The cuff needs to be, I'm going to take my 3 fingers above the brachial pulse, and that's where I'm going to put the blood pressure cuff, with the arrow pointing down to the artery. Wonderful. So what I'm going to do is I'm going to blow up the blood pressure cuff, okay? And this is called pulsation obliteration. I'm going to use the diaphragm side of my stethoscope and listen for her pulse. When I no longer hear the pulse, I'm going to pump up the blood pressure cuff 20 to 30 higher than what it already was. Then I'm going to let this air out slowly and listen to the systolic and diastolic. Here we go. Okay, just relax for me. I'm just going to take your blood pressure. This shouldn't take long. Okay, this patient's blood pressure was 118 over 58. The gold standard blood pressure is 120 over 80. So this patient does not have high blood pressure. Cassandra, I want to thank you for coming in today. I took down all your vitals and everything. Your vital signs look good. Your respirations are good. 16 respirations per minute. Your pulse was 72, and your blood pressure is 118 over 58. Those are all within the range of blood pressure or of vital signs. So you're good there. The doctor's going to be in a minute, and he's going to assess your rash. And we're going to figure out what's wrong with you, okay?
Okay, thank you.
Okay. It was nice meeting you.
Thank you.
Bye.